Hi Sam, nice to see you. Before we chat, I'd like to share a short video with you.
For some people, it can be challenging to look at or touch their genital area. Taking the time to get more comfortable with yourself or seeking help from your healthcare team will empower you to manage your own care and improve your health and quality of life. In this video series, we will learn about the female pelvic anatomy and how to self-catheterize in a variety of positions and settings. Before attempting self-catheterization, it is important to familiarize yourself with your own pelvic anatomy. Familiarizing yourself with your anatomy allows you to visualize where the catheter will be inserted. Knowing the appearance of the labia and the location of the urethral opening ensures proper catheter insertion with minimal hassle. Understanding your own preferences can help you choose the best catheter type and determine the physical positioning that works best for you during self-catheterization. You may find that a specific catheter style or size is more suitable, or that a particular insertion angle or body position works best for you. The more familiar you are with your body, the better equipped you'll be to make these choices. Getting acquainted with your pelvic anatomy makes the process of self-catheterization less intimidating. By taking the time to explore and get comfortable with your own anatomy, you'll feel more confident when it comes to inserting the catheter. Remember, there's nothing wrong or bad about getting to know your own body.
So Sam, there are two approaches to getting familiar and comfortable with your own anatomy: through touch or by using a mirror. Some people start by using both, and then graduate to relying only on one or the other. When familiarizing yourself by touch, there are two approaches you can use. One is you feel the touch of the catheter on the urethra, the opening where you'll insert the catheter. The other approach, depending on the degree of feeling you have in your fingers, is to touch the spot you'd insert the catheter tip. Start first by using a mirror to help you develop the ability to use touch. As you get more comfortable and familiar with your body, you will evolve your own method. Taking the time to learn about your own pelvic anatomy leads to a smoother, safer, and less stressful self-catheterization experience. The more informed you are about your own body, the better. The actual parts of the female pelvis are shown in this diagram. The parts that correspond most directly to self-catheterization are the labia and the meatus, the urethral opening. Before we start looking at how to do self-catheterization, I want to first say, as important as it is to become familiar with your own pelvic anatomy, you should know most everyone's pelvic anatomy looks different from examples you might see in medical or clinical illustrations, like the one we just looked at. For example, your labia, clitoris, urethral opening, vaginal opening, and anus may be positioned differently than they are in a generic clinical diagram. Also, some women will have larger or more pronounced labia, while others have smaller labia. The clitoris can vary in size and location as well. We use those generic clinical images to help understand the general composition of the pelvic area. Your anatomy will probably not be exactly like you see illustrated in guides and formal learning resources, Sam. But all these differences you might encounter are perfectly normal and healthy. That's why, before you try self-catheterization, it's so important to take the time to closely examine your own anatomy with a mirror and, if you can, your fingers. Specifically, becoming familiar with the look and location of your urethral opening. Understanding your own anatomy will make catheterizing much easier. I'm happy to help you get familiar with your own external anatomy, Sam, and answer any questions as you get acquainted with your body.